We're joined now by Dr. Julian Perez of CMAR Community Health Center. He is a family physician. He treats people who have battled COVID-19. And in fact, he's also had to battle the virus himself. And we'll talk about that shortly. But first, Doctor, welcome. Good to have you with us.
Good to be with you again.
So tell me about the folks that you see.
We see people of South King County in the clinic that I work in. CMAR in general, we are responsible for the population, the underserved population from the Canadian border to the Oregon border and from the Cascade Mountains to the ocean. There are many clinics, doctors, and community centers that care for the population. We were founded to take care of farm workers, and now we basically take care of anybody that comes to our doors. In King County, our clinics are located in the south part of the county where the majority of people of color live. So our demographics, probably around 50% to 60% Spanish-speaking patients, mostly Medicaid or uninsured, a little bit of Medicare folks. And we do all services under primary care that would include well visits, urgent visits, walk-ins, ill visits, cancer prevention. Now we're expanding to specialty care. And so I also do sports medicine and musculoskeletal medicine.
So how has COVID hit your work?
So COVID was a real unwelcome surprise. A year ago, we have dealt with flu season every year. And so we have very good protocols for trying to control the spread of influenza in the community and in the clinic. But until this pandemic came in to the United States, we really were functioning as more of a primary care clinic. I would say we had a little bit of reach into the community and doing some public health collaboration with public health. You know, we would follow public health protocols and guidelines in the care of our patients, but we were not actively working in public health until this pandemic, and I didn't fully appreciate that until now. When I see a patient that has symptoms of COVID, I'm not just thinking about the person in front of me. I'm thinking about their family. I'm thinking about where the kid goes to school. I'm thinking about the father's workplace. I'm thinking about the mother's pregnancy. I'm thinking about their church. And front in my mind is how do we contain this virus? How do we limit this virus to the person in front of me, so the family doesn't have to all get sick, and that their extended family and their community doesn't have to get sick? Because in an epidemic where you have an infection in the community, public health traditional approach is to diagnose, isolate, contact trace, and squash that as locally as you can. But once this was identified to be a community spread novel virus, it just spread so quickly. We didn't appreciate how easily it spread in the air. We didn't appreciate how benign it could look. And we didn't appreciate how severe it could be when it hit us. We didn't know what it looked like when it first came to town. And I know that for sure I saw many patients that had COVID that I let go home. I okayed to travel to see their families in Oregon because all we knew was fever, cough, shortness of breath. That's all we knew. So yeah, that crystal ball is humbling. It's a humbling experience.
Wow. So why do you early on, no one knew what was going on, right? But as the picture emerged of who was actually being affected the most, obviously it became clear that communities of color were really taking the brunt of it. Mm-hmm. I mean, why? I guess they didn't disclose that right away. Did they not know who was being affected mostly?
So I think a couple of things we know now is that this virus is in the United States much earlier than March 1st. March 1st, I will never forget, because that was the date that, actually it was March 2nd, that we went live with our new electronic health record system, which is a really big deal in any clinic. But on that Monday, priority one was not the conversion, it was the pandemic. Yeah. So when it hit town, we knew about the Life Care Center nursing home, where they found a large number of cases. And so that's a place where I don't know the demographics of that nursing home, but it seemed that the virus came in on planes from business trips, from kind of higher SEC activities. And when it hit the community, it hit North Seattle, it hit the east side. At least that's what we were seeing in the news. And then once it was reported to be in the community, we started seeing our own patients come in with it. A lot of our patients clean homes, they do construction, they work in the nursing homes and hospitals and clinics. But we have a younger population. And so when they get sick, it's not as severe. They tend not to, at least when it was not very common still in the community, we weren't seeing many people dying of viral pneumonia or respiratory failure in the hospitals yet. And so I think it went undetected for quite a while. And finally, when that big peak in April hit, it was very clear that many of our community was sick. And public health colleagues were telling us this is going to hit the communities of color worse, because as folks are able to isolate and stay home, that is really a privilege of people who have high educations and good jobs that allow them to do that they can work from home. Our patients can't. They have to be on site. Many of them can't read and write, or they can only read at a 6th grade level in their own language, not even in English. And so they're really doing quite a bit of labor work, which they can't do from home. A lot of our patients are undocumented and do not advocate well for themselves as far as safety in the workplace. So one of the earliest things we did on the radio was to encourage people to advocate for their own safety, to make sure that there were gloves and masks and gowns, and to not go to work if those things weren't available to them. But that is a really big risk for our patients, because so many times in the past, our day laborers would come to clinic and they would be sick, and we'd tell them you have to go to the hospital, and they would say, no, I can't go to the hospital because if I miss work, they'll fire me. Yeah. So there's a lot of injustices that exist in the lives of our patients, and it's that same injustice that really became front and center during this pandemic, because the people who don't have the means to take care of themselves and take care of their families are the ones that we saw later, past April, then huge numbers of people of color were getting sick. And the African American community
is part of that because they don't have the same access to healthcare, that they have prior existing conditions, and it's sort of a pandemic on top of a pandemic.
So anybody in this country that is undocumented or lives in the poverty, under the poverty level, even people we would consider white American citizens that are the working poor, they will have more challenges with health because of the chronic stress that comes with their lives. It knocks down their immune systems. They tend to not have the money to buy healthy foods. They tend to not be able to recreate and exercise for joy. Most of their exercise comes at work and maintaining a home, because they can't afford to have other people come in and do those repairs for them. So a lot of them end up with chronic diseases like hypertension, hypercholesterolemia, diabetes, and obesity. And those are the fertile breeding ground for bad things to happen with COVID, unfortunately. So I wouldn't say that people have worse access to care, at least not in King County. No matter who you are, if you're sick, you can show up at a clinic somewhere, you can go to the ER somewhere, you will be directed to a place that you'll get care. So I wouldn't say that that's a huge part of the picture here in Seattle, but other parts of the country for sure. And I will tell you, we've had many people move to Washington State because they could get health care here from other states. And I'll name them: Florida, Georgia, Texas, California. Yeah, for sure.
Really? Still, the racial and economic disparities that they were heightened by the pandemic, but they've been there before. So this only compounds it, right?
Absolutely, absolutely. When you have a pre-Trump administration society, there was systemic racism always. But the social compact says that if you're a person, if you're an immigrant, for example, and you're working in the country, then there's jobs that some of us don't want to do and some of us can't do. And so we're going to leave those jobs, those really jobs that we don't really want to do, we're going to leave them for the immigrants, and they will bust their butts and they will take the risks to their health and their lives to work the beef, as they say in Yakima, butchering cattle and preparing our meat for our dinners. They will work the fields in 110-degree heat and risk kidney failure. They will work the fields picking apples and risk the exposure to pesticides and herbicides. And they'll take those dangerous jobs because they are building a life for their families and their kids. We all went through that back, and if you track your generations back in your own families, every one of our families went through that, unless you're Native. And of course, then you suffer genocide, and that is another story. But the lives of our patients reflect the challenges that they have to go through, and their health is a reflection of that as well.
And yet they're essential workers.
Completely, yeah. And that's the phrase we never used to use before, but now we realize when everybody, has to stay home and you shut down the country completely, like we did in April, May. You saw those ghost town pictures of New York City, and even here in town, my patients were still going to work. I pleaded with them to stay home. I pleaded with them to shut their restaurants. They said, I can't. A restaurant is not a critical infrastructure job, but if I don't make money, I can't pay my bills, and I can't send money home to my families in my country where they don't have jobs. They don't have money. There's no economy there. And some of them are very, very unlucky that they're also being extorted by local gangs. And if they don't send money home, the gangs will kill their families. So this is tremendous pressure for our immigrant families to continue to work. And they had to get very creative in many ways, many instances, to find work they could do during the pandemic. A lot of it was under the table, as it always has been. I know several examples of very well-to-do people who refused to allow their yards to go uncut, or refused to allow their remodels to be paused, and found folks in our patient population and community that would continue to do that work for them when it was unsafe, and we recommended they didn't do that.
You contracted the virus. Tell
I
us
did.
about when that happened and what happened to you.
Let's see. So March is when this started. It was October 30th was the day that I got sick. So you imagine I went a long time, mask, gown, gloves, face shields, everything we could do to keep from getting sick. But, we didn't have enough face masks for a long, long time. And there was always the threat that we wouldn't have enough. And so I was saving face masks. I was reusing them constantly. I would spray them down with hydrogen peroxide. Maybe that's part of why I got sick. We don't really know. But October 30th, I just finished my hospital rounding week, and I came home and I was watching a movie with my kid, and I realized that my body was hurting and I was getting a fever. And so I went down to the basement and I stayed there for the next 12 days. We don't have a finished basement. We have a REI cot that we bought, and we have an REI emergency bathroom, basically, which is a bucket with a seat. And so I was in the basement for 12 days. And thank God we were able to keep me isolated well enough that my daughter and my wife didn't get sick. They were able to complete a 14-day quarantine. And we did that with a 2-bedroom, 1-bath house and an unfinished basement. But listen, so many of our patients don't even have that. They live in an apartment, and you guys will hear this phrase thrown around a lot, multi-generational households.
Yeah.
They live with the abuelita, they live with their moms and their aunts and cousins, and there may be 10 people sharing a 4-bedroom home. It's very tough to isolate when people get sick. Culturally, especially when someone's sick, we want to jump right up, help that person out, cook for them, massage their feet. It's very challenging for the Latino community to isolate somebody in a room. They feel like they feel like they've just expelled them from the family. And so what we hear, unfortunately, is that most of our families choose to go through this together. They choose to just get sick together and take what may come. And that was early in the pandemic. Now we've had families who've gone through this. They've heard the stories of their friends. They've lost loved ones, and they try really hard to isolate now. And in many instances, they're successful in keeping some of the family members healthy. And so they've learned, unfortunately, through trial and error, and that error has been tremendously costly for them.
There's still people out there that think this is a hoax.
Yes.
And it's just like the flu. You had it. What was it like? Why is it significantly different?
I've had the flu twice, and I had COVID once. I would say it starts out like the flu, body aches, chills, fever. But then for me, I had this tremendous heat that just took over my head, a raging headache. And then the next day I couldn't smell anything. And then there's a pause, it's this pause before the storm. And as a physician, I knew that pause would come, and I knew that the second round of this may cause respiratory failure and death. So that was pretty worried. I was pretty worried about that. And I think maybe some patients don't know how that goes, but as a physician, when you see this a few times. So, back in April, I had my first quarantine from an exposure. I had written my last will and testament then. I got all my affairs in order. And then I went through 3 more quarantines before I got sick. And every time I did that, I was in the basement. And so every time I would update my will, and I would inform my family and my wife what would happen in case I got sick and couldn't come back. And so this time when I got sick, the rubber really hit the road. We were really well prepared. We were well prepared. We had little boxes in each room with all the meds and thermometers and we needed. My sister came and dropped by an oximeter, which we didn't have, which is a really helpful piece of equipment. So you know when your oxygen is below 95, and that's when you need to go to the emergency room. And I called friends who had been through this, and they gave me advice. And for me, this was an incredibly just eye-opening moment about how many people cared, family and friends and colleagues and people I hadn't heard from in a long time, wishing me well. I hope everybody that gets sick goes through that. I hope something good comes out of this for everybody, but it's not always the case.
Yeah.
How tough was it to be isolated from your own family?
Well, my biggest fear was that it was their well-being, and by that I mean I didn't want them to get sick, but I also didn't want to die and then leave them, without a father or without income. So that was always front and center of my mind. My daughter was wonderful. She wrote me poems and she drew me pictures, and my wife cooked every meal and dropped it off at the basement door, and I would eat and we would, I put the dishes out. Then after that, pretty soon we switched to paper plates. We just threw them away to try and reduce the amount of cross-contamination based on advice from her doctor and my doctor. But yeah, my family was wonderful. Real troopers. I can't thank them enough.
How about side effects since, or after effects since?
My sense of smell is not perfect. In some ways, it's a blessing because I can clean the cat's box now. I don't get watery eyes. I don't smell the poop. It's okay. I can actually participate in the care of our cats now. But there's times when I smell coffee. It just smells like dirt, just very unappealing dirt, which is too bad. I love coffee. And by and large, I think I'm 100% now. There was about a month when I was still a bit fatigued. I lost about 10 pounds. Took me a while to get that back. I had to exercise slowly to make sure that I didn't overdo it. And I paid very close attention to my legs and my cardiovascular status, because there's a lot of people who end up with deep vein clots, pulmonary emboli, heart attacks, carditis. I've read about all these things. I'm 45, and so I want to make sure that I paid close attention to my body.
Such a young guy. Remember that, Matt, when we were
There you
45?
Yeah, I know. So Washington State has done a relatively, I shouldn't say good job, but a relatively okay job of keeping things sort of under control. But where are we now? With the vaccine looming, you know a little bit more about the disease. Where are we right now?
Well, I invite everybody to go to the COVID tracker, the CDC COVID tracker, and also to the state website. We're nearly 3,700 people have passed away from this pandemic in the state of Washington alone. About 1.4% of the people who have gotten sick have died. And we've got 260,000 plus confirmed cases. That would be, a really, really, really bad day in California. Think about that. They logged 1,000 deaths in one day. Am I making that up? 500 deaths in one day. There's places that are completely out of control. They're completely out of control. And I thank my stars that we live in the state of Washington, and especially in King County. We've got one of the best public health systems in the country. We always have. We have very smart people here. I trained here at the university. My wife trained in public health here. And the first thing she said when this hit, and I said, let's get out of this country. Let's go to Canada. Let's go somewhere with a good, solid social network and public health system. She said, no, we're staying put, because these are the people that trained us. They're very good at what they do. And when you're sick, there's no place like home. And she was absolutely right. She was absolutely right. We're in a good place. We have very good leaders. They're very smart. They're also very highly emotionally intelligent. They know how to talk to people. They give it to us like it is, just enough so that we can make the decisions we need to. I feel like it's been a very fair hand by the governor. Not everybody feels that way, but those decisions have been made with evidence and with science, not by fear. and he's refused to give in to the calls of some of our elected representatives and other community members demanding that those restrictions be taken down. But we can't, we're here to, when you're in leadership, regardless if that's public health leadership in a medical clinic or an elected leadership, we have to have an eye on the most vulnerable first. That is what government exists for. If there was no vulnerability, maybe then those folks' arguments would have some weight, but that's just not the way the world is.
You received the vaccine.
I did.
Just a short time ago. So
Yep.
how was the shot?
Well, nobody knows if you get sick, if that gives you lifelong immunity. That's really too bad, because to go through something so terrible and not be immune for life, we all hope that we are. But not knowing and continuing to be exposed to people on a daily basis, potentially with this virus, I have to get vaccinated. The vaccines that are out there now are very good, 95% effective, which is a really good vaccine by all standards. And nobody that got that vaccine died of the vaccine. We know that for sure. We also know that the symptoms that people get can be mild to moderate. And I wasn't sure in my case, since I'd had the disease, if I should get vaccinated at all. The CDC said that if you'd had COVID-19, you could wait up to 90 days. And not necessarily because you may not need the vaccine, but because there's very few reports of people getting reinfected in the first 90 days after recovery. And so that would give other people a chance to get the vaccine who had not been exposed yet and were high risk. So I decided initially to wait that 90 days. And then like everything in this pandemic, we learn something new every week. There was a report out of UK from their healthcare personnel that folks that had been sickened at work or in the community that worked in healthcare, at 60 days, their antibodies would wane potentially. And so right around 60 days, which was last week, I decided to get the shot. We have the Moderna shot here in CMAR. I could have gone to the Swedish where we admit patients and gotten the Pfizer shot. I just decided to go with the Moderna shot after talking with a few colleagues. And I had a pretty sore arm and I had a pretty sore body for a day or two. So this is not the flu shot. People complain to me all the time. I don't want to get the flu shot, Dr. Perez, because every time I get the flu shot, I get sick. And we say, you're not getting sick. It's your immune system giving you protection against that virus this winter. This one is a few standard deviations above that in my own experience. I've talked to some colleagues who've had similar, very sore arms, very sore bodies, feeling pretty miserable after the shot, but we know it works. And I will tell you that I've had both the shot and the disease is way worse.
How do we convince people out there that are saying, I don't want to get vaccinated. I'm against the vaccine. I don't trust the government. I don't trust the pharmaceutical. I don't trust the pharmaceutical companies.
I don't know, Ernie, if you can change their minds. There's some people that have gone so far down that rabbit hole of lies and conspiracy they may never come out. We can get the people on the fence, and we do it with, facts and data only go so far. I think what we really need to do is to find out who people trust. And when I talk on the radio, we always talk about the triple pandemic. The first one is the virus. The second one is this lack of trust in this country that's been going on for a long, long time. And the third is the systemic racism, the institutional racism that we have in this country as well. You take those three things and put them on top of one another, and we knew it was going to be really hard to control the pandemic and then also to convince people to get a vaccine when it came out. It's interesting that when people get sick, they're very interested in the treatments. They want the treatments. They'll take the dexamethasone, they'll take the convalescent plasma, they'll take the antivirals. But I'll tell you what, the dexamethasone is the only thing that works, and putting it on your face. It's the only two things that work. Everything else is probably ineffective based on all the research we've done. And we're talking tens of millions of people that have been studied. So the treatments aren't good, guys, and the vaccine works really well. I don't know how to tell people any more than that. I mean, you got doctors and nurses in the middle of this thing. We're taking care of people every day. Many of us have seen people die of it. Maybe we sign death certificates. Like, we know how bad this is, and we're lining up in droves to get this vaccine. That should tell you something.
So masks are still the first line of defense, right?
What's that?
Masks are still the first line of defense.
Absolutely. Yeah, I mean, absolutely. I think the CDC said no, NIH said in September, people wear masks between end of September and beginning of February, we could save 110,000 lives. And so at that point, the country was basically split 50-50 right down political lines. Democrats wore the masks, Republicans did not. That's pretty much how it went down. Maybe we've increased that now to 65 or 70% because of this latest boom in cases. But there's, a lot of people still refuse to wear the mask. It's easily the most effective way we have to control this thing. And we see that time and time again in other countries where people wear the mask because they just know that it works. It's common sense. They believe what the public health government institutions tell them, and they do well.
We saw that many of the folks that, we saw that many of the people involved in that mob that attacked the US Capitol were not wearing masks. Do you expect that to be a super spreader event?
Yes, everybody does.
Unbelievable.
I'm so sorry that it happened. I'm so sorry. We're all still processing that, but yeah, to add insult to injury, we're going to have a lot more sick people, and now all over the country.
Another bite. Go ahead, Matt.
Oh, I think people with the vaccine and everything else, people are looking for that TV ending, right? They want it to end soon, but realistically, it's not going to be over for a while, right, Doctor? I mean, we have a long ways to go.
You can go out in a ball of flames, or you can go out with a beautiful sunset. This is not going to be over for a while. If we could do everything perfectly, we were hoping this would be done by March or April this year, but we've done everything wrong. We've done everything wrong as a nation. And in order to get herd immunity from a vaccine, we need to get, I'm guessing now, let's just take best case scenario. If people who get this disease have lifelong immunity, let's assume that, which is not a good assumption. But if that was the case, we've gotten, let's see what the CDC says. We've got 22,300,000 cases logged. So probably that's only half or less. Let's assume 50 million people have had this disease. There's 315 million of us, right? And then we have to figure out how to vaccinate the others. And remember that this virus mutates. We've got mutations in UK, we've got mutations in South Africa. The vaccine should work against those as well because it's a spike protein, which is the defining feature of this virus. It should work. There's some early reports out of South Africa that may not be the case, but let's assume that it works. We have to have companies who can only produce about 100 million doses of this ramp up as quickly as possible. So if they got 100 million doses each, that means you can only vaccinate 100 million people because it's a 2-dose vaccine. And so we need other companies to come up with vaccines. That's why there's still many in phase 3 trials. We need people to volunteer for those trials. We need to complete those trials and get those vaccines to the clinics and the hospitals and into the communities. And we need vaccines that are more stable. This Pfizer vaccine is not a stable one. It can only be given out mainly in hospitals and a few clinics that have these special refrigerators. That's a limitation. We'd love to just take a box of these to a school and have the school line up with all their moms and dads and just stick them in the arm and knock out 1,000 people in 1 hour, but that's not going to happen right now. So there's still a long way to go. And let's just assume that we finally get all those conditions met and it's been a year. What if the virus ends up being an annual thing like the influenza, but it has 20 times mortality as influenza? So you guys, this may be a new normal. We may be all wearing masks for a long, long time.
You have been spending a lot of time trying to reach out to the Latino community through Spanish language radio. Tell me about the types of things that you've been doing to do that, and what has been the challenge, I guess, to get through? Because we Latinos, we like to be with our families, we like to hold our family members, and we like to party.
Yeah. So I think early on, people took this pretty seriously. Everybody was really scared of this, and the way we reached them, we went to the radio first of all. A lot of our community listens to the radio in Spanish, so we actually own and operate 1360 AM El Rey, and we operate another radio station in Granger, La Cadena, So we were able to get on the radio right away and start doing public health messaging. Just ask King County Public Health and Yakima County Public Health, what are your talking points? Give them to us. And we just say them on the radio. We interviewed patients. We felt like if people hear from their own community, that would be very influencing to their behaviors. And so I would find patients that were sick and I would say, you want to talk on the radio today? I want to talk on the radio tomorrow. And I did lots of interviews. We interview physicians that are in the middle of this pandemic, admitting patients to the hospital, medical residents, people who had lost family members, anyone who would be willing to come and talk. The other thing we did is Univision is another major outlet for news and information for our community. And so I worked with a couple of people through the Univision networks, and we did a few commercials and interviews. And then we also started a Spanish language King County run community forum that we meet once a week on Tuesday evenings at 5 o'clock to 6:30. And it's Q&A, but it's also messaging and training of the trainers. So mainly the people that are that come to that are promotores de salud. They are more or less the formal, informal health promoters of their
Online, all of this is online?
Yeah, you can just go to the website at King County. It's called Condado King, Salud Pública, and you can find the link where you can get into that. So it's all in Spanish, and I attend that frequently. Dr. Matias Valenzuela of King County Public Health attends that every time, as well as many of the people who work within the King County, whether they're in public health or not. But if they're Latinos and they speak Spanish, they've brought them over for the pandemic to help out. And it's been tremendously helpful to hear from the community. Dr. Valenzuela's ask to us was exactly that. He just said, I need to hear what the people, what's going on with the people. We need to hear from them. And so that was the idea. And so I think those three outlets, a forum where people can talk openly about their concerns and suggestions, being on radio and being on Spanish language TV has been the ways that we've tried to do the outreach.
Well, Dr. Julian Perez, first of all, thank you for your work on the front lines of all of this, and to all of those that are healthcare folks that are dealing with the pandemic and putting your life on the line. And in your case, I'm glad that you recover. I hope you make a complete recovery and don't have to change your will anymore. But thank you so much for joining us. And we really appreciate you and your work. And please come back again so we can kind of do an update.
Happy to do that. And I want to end with a phrase we use on the radio a lot. It's in English, it's we will be victorious, we will win. Juntos venceremos. Together.